In recent years, the rising cost of prescription drugs has become one of the biggest concerns for millions of Americans. Families have struggled to afford life-saving medications, seniors on fixed incomes have had to choose between food and medicine, and even insured patients have faced high copays and deductibles. Against this backdrop of frustration and uncertainty, former President Donald Trump has introduced a new initiative called TrumpRx, a platform that he claims will revolutionize the way Americans buy their prescription drugs. But what exactly is TrumpRx? How does it work? And most importantly, who does it actually help? This script takes a deep dive into all of these questions in a clear and structured way. TrumpRx is presented as a government-backed effort to lower prescription drug prices by cutting out middlemen and allowing Americans to access discounted prices directly from pharmaceutical manufacturers. Unlike traditional pharmacies or insurance-based systems, TrumpRx is designed as a digital marketplace where consumers can search for medications and see transparent pricing. The idea behind this platform is simple. If Americans can see what drugs cost in other countries, and if they can access similar prices, then they will no longer have to overpay for essential medicines. The launch of TrumpRx has been framed as a major victory for American consumers. Trump and his supporters argue that for decades, big pharmaceutical companies, insurance providers, and pharmacy benefit managers have kept drug prices artificially high. They claim that TrumpRx breaks this cycle by introducing what is called a most favored nation pricing model. This means that the price Americans pay for certain medications should be comparable to or even lower than what people in other developed countries pay. At the heart of TrumpRx is a website, TrumpRx.gov, which functions like a search engine for discounted medications. When a user visits the site, they can type in the name of their prescription drug and see whether it is available through the platform. If the medication is listed, the website shows a lower negotiated price. However, it is important to note that TrumpRx itself does not sell drugs directly. Instead, it acts as a gateway, redirecting users to pharmaceutical companies' official websites or providing digital coupons that can be used at participating pharmacies. This approach is different from traditional drug purchasing. Normally, when an American goes to a pharmacy, the price they pay is influenced by their insurance plan, their deductible, and complex negotiations behind the scenes between insurers and drug manufacturers. With TrumpRx, the process is more straightforward. It is essentially a cash-based system where consumers can access discounted prices without going through their insurance. One of the most talked about examples of TrumpRx's impact is the fertility drug Gonal F. Before the launch of TrumpRx, this medication was priced at around $1,449 per pen in the United States, making it unaffordable for many couples struggling with infertility. Under the TrumpRx pricing model, this same drug is now available at a significantly reduced cost. Supporters of the platform point to this as proof that the system works and that Americans can indeed benefit from fairer pricing. However, while TrumpRx has the potential to lower costs for some medications, it is not a perfect solution. One major limitation is that it primarily benefits people who are willing and able to pay cash for their prescriptions. Unlike traditional insurance plans, purchases made through TrumpRx do not count toward a patient's deductible or out-of-pocket maximum. This means that even if a drug is cheaper through TrumpRx, some patients might still end up paying more in the long run if they rely on insurance coverage for other medical expenses. For uninsured Americans, TrumpRx could be a game changer. Millions of people in the U.S. do not have health insurance, either because they cannot afford it or do not qualify for government programs. For these individuals, prescription drugs are often extremely expensive, sometimes even inaccessible. TrumpRx provides them with a potential lifeline by offering lower prices without requiring insurance. Similarly, underinsured individuals, those who have insurance but face very high deductibles, may also benefit from TrumpRx. Many Americans technically have insurance, but their plans are so expensive that they still have to pay thousands of dollars out of pocket before coverage kicks in. For them, paying a discounted cash price through TrumpRx might be more practical than dealing with insurance bureaucracy. Another group that could benefit from TrumpRx is patients who need brand-name medications that are not preferred by their insurance plan. Insurance companies often push patients toward generic alternatives or specific brands that they have negotiated lower prices for. If a doctor prescribes a different brand, the patient may face high copays or even denial of coverage. TrumpRx allows these patients to bypass insurance restrictions and purchase their prescribed medication at a reduced price. Beyond direct cost savings, TrumpRx also promotes price transparency. In the current U.S. healthcare system, most patients have no idea how much their medication truly costs. Prices can vary wildly between pharmacies, and insurance negotiations happen behind closed doors. TrumpRx makes pricing more visible, allowing consumers to compare costs and make more informed decisions. Despite these advantages, critics of TrumpRx have raised several concerns. One major issue is that the platform currently lists only around 40 brand-name drugs. While this is a good start, it covers only a small fraction of the thousands of medications available in the U.S. Many common prescriptions, including some for chronic conditions like diabetes, heart disease, or mental health, may not yet be included. There are also concerns about conflicts of interest. Some investigative reports have suggested that individuals connected to the Trump administration may have financial ties to companies that stand to benefit from TrumpRx. Critics argue that this could undermine the credibility of the platform and raise ethical questions about its true motivations. Additionally, there is uncertainty about how sustainable TrumpRx will be in the long term. Pharmaceutical companies are profit-driven businesses, and offering significantly lower prices in the U.S. could impact their revenue. Some analysts worry that if too many Americans rely on TrumpRx, drug manufacturers might respond by limiting availability or increasing prices elsewhere. Another important consideration is how TrumpRx interacts with the existing healthcare system. The U.S. healthcare industry is incredibly complex, involving hospitals, doctors, insurers, pharmacies, and government programs like Medicare and Medicaid. TrumpRx operates somewhat outside of the system, which could create confusion for patients who are unsure whether to use their insurance or the new platform. For seniors on Medicare, the situation is particularly complicated. Many elderly Americans rely on Medicare Part D for prescription drug coverage. If they choose to use TrumpRx instead, they may miss out on benefits tied to their plan, such as coverage for other medications or protection against extremely high costs. Despite these challenges, TrumpRx represents a bold attempt to address one of America's most pressing healthcare issues. Whether one supports or opposes Donald Trump, it is difficult to deny that high drug prices have become a crisis for many Americans. TrumpRx at least forces a national conversation about affordability, transparency, and fairness in the pharmaceutical industry. From a broader perspective, TrumpRx is part of a larger global debate about healthcare and capitalism. In most developed countries, governments regulate drug prices to keep them affordable for citizens. In the United States, however, the market-driven approach has led to some of the highest prescription costs in the world. TrumpRx tries to bridge this gap by bringing elements of international pricing into the American system. For everyday Americans, the key takeaway is this: TrumpRx is not a magic solution that will make all medications cheap overnight. It is a tool, one that could help certain people in certain situations, but not everyone. Patients must carefully compare prices, consider their insurance coverage, and consult their doctors before making decisions. Looking ahead, the success of TrumpRx will depend on several factors. Will more pharmaceutical companies join the platform? Will the government expand the list of available drugs? Will future administrations continue to support or dismantle the program? These are questions that only time can answer. What is clear, however, is that TrumpRx has already made an impact by bringing drug pricing into the spotlight. It has challenged the status quo and reminded Americans that access to affordable health care should be a priority, not a privilege. In conclusion, TrumpRx represents both hope and controversy. For some, it is a much-needed step toward fairer drug prices. For others, it is an incomplete and potentially flawed experiment. But regardless of perspective, it has sparked an important conversation about how America can build a healthcare system that truly serves its people. For now, TrumpRx stands as a symbol of change, a reminder that even in a deeply divided nation, the issue of affordable medicine is something that affects everyone. Whether this platform will ultimately succeed or fade away remains to be seen, but its launch has undeniably marked a significant moment in the ongoing struggle to make healthcare more accessible for all Americans.